Are you someone who always feels pressure at the base of your skull? You're foggy headed. Your vision's a little off. Your balance isn't what it used to be. And you kind of can correlate this to a car accident or a slip and fall, or you had a head trauma from taking a hard ball in the face for a baseball bat in the face. There's any number of blunt traumas that can dislodge the top vertebra in the neck. And this is a very important, what we call choke point. So most people, when they have chronic health problems, they end up in the medical system, they spend thousands of dollars on testing, and then they get named or diagnosed with something, and then they have a drug thrown at them, or they end up in physical therapy, which absolutely has some value at times. But many times people suffering with chronic issues that followed a head type trauma are due to a structural disrelationship of this top vertebra and the skull. Now this area, that hole right there, is a very important area we call a choke point, because through that hole is the brainstem and spinal cord. Cerebral blood flow. Arterial blood flow. That's oxygenated blood from the heart traveling up into the brain. Venous blood drainage. That's oxygenated blood has been used by the brain, and then it flows back down through that hole back to the heart and through the lungs, where it's recirculated again. And then inside of your brain, we have these things called ventricles. That's where cerebral spinal fluid flows. And there's a very delicate pressure balance in the brain, an interplay between CSF fluid, arterial supply, and venous supply that is all governed by pressure gradients. And what I'm getting at is when you have a trauma and that top vertebra locks out of position under the skull, it's not just a bone on bone. You have soft tissues in there, you have ligamentous membranes, and of course the cord. And then over the cord, you have a structure called dura mater, which is a sock type sheath that connects into the skull also. And so when you have a trauma, this 10 to 12 pound mass and this 2-ounce vertebra can have a disrelationship. It's a very quick whip. It tears the soft tissue. That vertebra locks out of position under the skull. We're talking millimeters. It doesn't move the way it should. And then the structure starts to adapt. The neck muscles get tight, and that pressure you feel at the back of your head is just a protective mechanism of the suboccipital muscles tightening to try and shore up that damage that's been done. But an upper cervical misalignment can have a cascade of far-reaching effects through not only brain function, but musculoskeletal function, balance, energy, sleep patterns. And so if you're someone who has had a head injury or an accident and you're dealing with a lot of the problems that I just discussed, what you need to do is you need to get to an upper cervical chiropractor who specializes in 3D imaging to see how that segment has misaligned. And then a very precise correction is made with no twisting, popping, or pulling to get the segment back in its normal motion. So all the soft tissue that has been injured in that area can heal and repair, and that takes time. And the structure can come back into balance. And then of course, all the structures that flow through that hole can start to work the way they're supposed to, and the neurophysiology can start to return to normal. We do offer a free consultation here in our Sarasota, Florida office. If you're outside of Sarasota, Florida, you can go to a website that houses upper cervical chiropractors throughout the world. That's www.uccnearme.com.